Good afternoon from H&D Barbershop, Toledo, Ohio. This is Dr. Anthony Pattin. He would like to talk about his African-American pharmacy that he opened in the city of Toledo. We're very proud of this young man. He worked hard. He's from the inner cities of America. He also is a professor of pharmacy at the University of Toledo, and it's an honor to have this young man come to talk to us.
Thank you so much for that introduction. So today I just want to tell you about Junction Family Pharmacy. We are located at 1339 Doris Street. We are a full-fledged pharmacy, and we are Black-owned in the city of Toledo. It's been a long time since we've had a pharmacy like that, and I am just excited to serve the community. This is a community where I'm from, and I'm here to take care of you, whatever that means, whatever I can do. So that involves filling prescriptions. We also have medication packing. So if you're tired of all the prescription bottles, I do that. I also sync your medications. So if you're going to the pharmacy 2 or 3 times a month, we can sync all your medications together so that you're getting them once a month. And we can check to see how well you're doing on those medications. So it's not just simply dispensing the medications to you, but also checking in with you to make sure they're working for you and that they're appropriate for you. So come check me out. I'm open Monday through Friday, 9:30 to 6 p.m. I'm also open on Saturdays from 10 to 2 right now. And I do make special accommodations, so if you need time or prescriptions outside of that time, I can do that. So come see me. So thank you very much.
Also, Dr. Pattin, what was the reason, what made you, inspired you to want to be a pharmacist, and why you want to get back to your community? Because this is something we really need in our community, and we appreciate it, but why did you really want to do this for your people?
Well, I became a pharmacist to help people. I learned about Ella P. Stewart actually in high school. A neighbor told me about her because I helped her with her medications. And I looked it up. I went to pharmacy camp at the University of Toledo. And that was the main reason I became a pharmacist, to serve people. I did extra training, so I did a residency in community pharmacy practice. And that enabled me to be a professor. I've been a professor for 15 years. I've been at the University of Toledo. I taught students there pharmacy law. Actually, I had students to score the highest in the nation one time. I also taught at Wayne State University, and I taught at University at Buffalo SUNY recently. But with the Rite Aid departures and the need for community pharmacy, I decided to step out of the professorship and go right back in the community. And I can tell you, it's been so rewarding to me to have people come in, they need the services, and treat them well. I get to talk with them, and it's just been really rewarding since opening the pharmacy. We opened last month, so we're going a month strong. And at this point, come visit the pharmacy, and you don't have to visit, actually. We can transfer your prescriptions from wherever you go. And I really want to talk about transferring your prescription. It's really an easy process. All you have to do is contact me, and I can call the pharmacy where you go. So if you go to another pharmacy in town, you just call me, and I can call them to transfer your prescription. So we make the process easy for you. Additionally, your doctor can send in prescriptions electronically. So it makes it very easy for you. The goal is to make it easier on you. I know that people don't have a lot of time. People are stretched for time. And so how can we make your experience at the pharmacy easier? Not so many trips. And we can do that at Junction Family Pharmacy.
Okay, and that's the most powerful thing about it, man. When we have African-American gentlemen and women come back to our community and try to uplift it. Now, the services you provide, now, what kind of medical do you take? Do you take VA? Do you take Medicaid? What one do you take? Do you accept all medical?
So I'm glad you asked that. I take everything. So I'm contracted with all insurances, and if there isn't an insurance I'm contracted with, I become contracted with them. So I'm contracted with everyone in the local area here. Also, if you have to use discount cards, maybe you use GoodRx, I can beat those prices. So I can make those prices, I can match prices or even lower prices. So if you have medications you're paying out of pocket for, you can call me and we can check on the price, come up with something together so that you can get your medications at an affordable price.
Okay, another question, Dr. Anthony. Now, can you send prescription across state lines to other states?
Absolutely. So we do commonly fill prescriptions for patients in Michigan, in Ohio, because some people, they live, they work in each other places. But yes, we can fill prescriptions from out of state. It happens sometimes. Sometimes there are patients who they live in Florida in the wintertime here, and then they come back here in the summertime. So sometimes we have to do that where we fill prescriptions from out of state.
Okay. I really appreciate you coming into our community and uplifting it and giving back. So I thank you. And like I said, man, I know you're going to be successful because you're a hard worker. I know your family, and I'm extremely proud of you. Thank you, Dr. Pattin.
And one more thing, I am going out in the community. So today I came to the barbershop we can do some screenings and just share some snacks and discuss the pharmacy. So if you have any suggestions of another place I could go to visit, please let me know. Let us know in the comments, and I will try to visit that location and talk more about the pharmacy.
Thank you, sir. I appreciate it. Thank you.